Surgery of the day, mid-shaft clavicle fracture. Our patient today is a 15-year-old young man who fell on his right shoulder and sustained a mid-shaft clavicle fracture. In other words, the bone is broken in the middle. For most clavicle fractures, the treatment is usually non-operative. In other words, we just ask the patient to put his arm in a sling and we start physical therapy treatment after 4 to 6 weeks. However, there are 4 instances where we have to operate, and these are the following. Number 1, when there's an overlap between the 2 fragments of more than 2 centimeters. Instance number 2 is when one of the 2 bony fragments has a bony spike that can poke through the skin. Number 3, when there's an expanding hematoma. In other words, there's bleeding that is accumulating and increasing in size. And lastly, when the 2 bony fragments are at a certain distance from each other, and we call that a displaced fracture. Our patient today had a fracture of this type where the 2 bony fragments were displaced. So we had to operate, and the operation is called open reduction internal fixation. In other words, we make an incision, we put the 2 bony fragments next to each other, and then we fix them with plate and screws. Here you can see the fracture before the surgery and after the surgery. Our patient should be able to start using his hand and arm the next day. He should be able to use his hand and arm for daily life activity. We shall see him in a 2 weeks' time to check on him, and physical therapy treatment should start within 2 to 4 weeks.